Hi doctors! I just wanted to take a moment to get to know you because of these COVID times. I probably won't be able to in-person meet you, but I want to introduce myself. I am Melissa Gracia Chisholm.
And I'm Anna Milano.
And together we are
Voice Rehab.
And so we have been working down in Care Center 1 every Friday, treating patients with voice disorders and swallowing disorders, and it has been amazing. So we wanted to just give you a little bit about ourselves and then tell you how we can support you in your offices this coming spring.
Yeah.
So I have been a speech pathologist for over 10 years now, and I went to Nova Southeastern University, got my undergrad degree at Adelphi University. I went to Berklee College of Music. I am a singer first. That's how I got into this voice specialty. I worked for Memorial Healthcare System for 5 years, so many of you have already been referring patients to me throughout the years. I worked for Catholic Health Services for 5 years, and currently I am the manager of speech pathology at Cleveland Clinic. There I have been working alongside ENTs as their voice specialist.
I also went to Nova Southeastern University, and I'm currently working at Memorial Healthcare Systems and at Baptist at Bethesda Hospital East and at ENT Associates at the moment. I also learned all about voice and swallow through Melissa at Cleveland Clinic, 3 months of direct observation, and I've learned a lot. Voice and swallow is my passion.
So here are some of the things that we can offer you with voice diagnostics and treatment. So when you have a patient come into your office and you find vocal cord lesions, vocal cord paresis, paralysis, presbylarynx, such as hypophonia with Parkinson's disease. Pretty much all of the patients have muscle tension dysphonia these days. And ILO, which is inducible laryngeal obstruction, or some of you might know this as vocal cord dysfunction. Also, the care of the singing voice, professional singers, even just, worship leaders. I'm a worship leader at my church. I love working with singers, along with neurogenic cough. So you might think about these patients that are coming in with this cough, tickle sensation, and we are now treating what we like to call it as neurogenic laryngeal hypersensitivity, but most people just call it chronic cough.
Yeah, so that falls into the kind of therapies that we do. We provide voice therapy that is all ASHA approved, evidence-based techniques, and it's usually it can go from 2 to 8 sessions. We specialize in different techniques such as forte, vocal function exercises, semi-occluded vocal tract exercises. Something that is really important is we provide manual techniques or circumlaryngeal massages, and we found that that has been very helpful to our patients that have muscle tension.
Absolutely.
Yeah. Other things, we provide LSVT, the Lee Silverman voice training therapy, resonant voice training, flow phonation, and that cough suppression techniques.
So that's a lot about voice. On the other side of things, we want to talk a little bit about swallow. So a lot of your patients who come in with some type of dysphagia, whether that's an oral dysphagia or pharyngeal dysphagia, we can absolutely support them. Diagnostically, most of you are probably ordering a modified barium swallow study, but in office, we can provide a fiber optic endoscopic evaluation of swallow, which the acronym is FEES. So this is amazing for our patients for biofeedback. They also can be bringing in their foods from home. So, you have that patient that says, it only happens and I only choke when I eat rice. Or it only happens with this one large pill and I know it gets stuck right here. So this is awesome for these patients because they can actually see what's happening inside the pharynx as they're swallowing. And then we can pull you in for certain things that we might have questions on. Maybe not the physiology of the swallow, but anatomically, if there might be something that can be done, like an upper esophageal sphincter might be tight and needing a dilatation, and we can discuss the findings together right there in office. So as far as treatment goes, Anna, you want to touch base on that?
Yeah, absolutely. So as far as treatment goes, It could vary again from any 2 to 8 sessions. And we just provide strategies, diet management, swallow exercises. We are also able to provide expiratory muscle strength training.
Good
And-
cough.
Yeah.
Good cough. Yeah.
Yeah. That will get us a really, really nice cough, because dysphagia, very important to keep that airway safe. With a strong cough, we can expel those foods that might go down the wrong pipe. And it's really good to have that feast for biofeedback, and also caregiver training and education.
Yeah. So that brings me to another thing about head and neck cancer. So I've taken many courses on head and neck cancer treatment. A lot of that becomes dysphagia management, but I'm also proficient in changing tracheoesophageal prosthesis. So I've worked with the Atos and InHealth products. Also providing education and counseling for stoma care and HME housing. So please refer your patients to us. As far as going back to the dysphagia management, there are some intensive therapies that we do not provide, only because we are not in one location every single day. So something like the McNeil dysphagia therapy, we have lots of patients that are very successful, and we are in connection with those speech pathologists that are able to offer that kind of intensive swallow therapy. But starting with us is really a great place to get a good plan of care. And then we might even be referring back to a modified barium swallow study, because a lot of stuff can be happening in the esophageal phase that we just can't see with fees.
And we also provide services in Spanish.
Yay, that's
Something good
really
to point
good.
out. Yeah.
So right now we're in Miami location on Fridays, and looking forward to expand and work with all of you in the very near future. Great.
Yes.
See you soon.
Bye.